You know, it's been two General Assemblies since the Virginia Health Care Freedom Bill has been enacted in Virginia, right? In light of this enactment, will you delegates in the next General Assembly vote for health care databases, health care exchanges, health care compacts, or any other health care initiative that furthers the design of a national government, Commonwealth of Virginia, Obamacare public policy harmonization? Or will you move in the opposite direction with legislation or supportive legislation which deregulates health care in Virginia, thus returning health care to the private sector?
Well, I love moving in the direction of the private sector. As I said, I think competition is good, and we should be trying to undo the various things that Obamacare is doing to citizens of the Commonwealth. And I'm not going to speak for my colleagues, but I oppose the creation of a state exchange because the federal government has, in my view, unconstitutionally, but the Supreme Court has ruled that they can create this kind of federal entity. The federal government has said either Virginia needs to create an exchange to implement Obamacare, or the federal government will implement it for us. I'm not interested in helping the federal government implement Obamacare, so I'm saying no. I'm not going to support the establishment of an exchange to do that work for them. If they want to do it so bad, they could try, but I'm going to resist it. And I hope that we in the legislature pass laws that will resist the implementation of Obamacare.
And I would agree with that. I think the initial legislation related to the exchange was looked upon as Virginia controlling its own destiny. Now I think after further reflection and now what occurred with the Supreme Court, most of us have come to the conclusion that it's better to make them set up the exchange and the like and resist as much as we can from the state level. To be honest with you, most of us, because of the complication of how the program and the law is set up, the fact that it's so onerous, it has so many pieces to it, we don't think the federal government can meet in their own deadlines in setting up exchanges and the like. So I think the governor took the right tack in saying let's not set up an exchange and allow the federal government to do what it's going to do under their federal law. But I agree, basically with Ben's direction.
What do you think, Dickie Bell?
I don't support state exchanges. Last year we had the dialogue, and it sounded as if we opted for the state exchange instead of the federal exchange. We have control of it. As it turns out, states have no control.
That's
All we do is pay in, and they still have the authority. So I don't support anything. You know, this health care, this affordable health care, we were told in the beginning that this was going to be affordable, and it's not. And we were told that everybody was going to have insurance, and they're not. When it's all said and done, there'll be 20 or 30 million people who still don't have health care insurance. For a lot of the rest of us, it's going to be unaffordable. So what do we do about that now, at this point in time? I'm not sure legislatively what we do. I'm not sure what the bill needs to say that says we're going to totally reject it because there's so many moving parts to affordable health care.
What we've essentially done in Virginia is called the federal government's bluff. We've said, we don't believe that you actually are going to be able to implement Obamacare nationally. Good luck creating this national exchange. I know the kind of database that's required to modernize our healthcare data, to make it available on a nationwide basis to providers, to insurers, to, I've talked to insurance agents who say it's not feasible. And to do so would require the hiring and paying of so many federal employees that we can't afford it as a country. It's way beyond the scope of Obamacare. So they're going to try. I'm not of the mind that they're going to succeed, and So we will do our best to keep Obamacare out of Virginia.
Dave, have you read the whole bill?
The whole bill? No, not the whole bill, but it's common sense. I'll tell you an interesting fact. I heard on the internet, and this is quite a while ago, that doctors were reporting that health care would go down 60% if government, and that's all governments, federal, state governments were out of all phases of health care providing. That includes insurance companies and hospitals, big pharma, and all this. That health care would go down 60%. Well, that sounded like an astounding figure to me. I mean, I couldn't really quite believe it. So I got it into my head. Well, I'll just go around in my travels, and when I meet a doctor, I will ask them this question: how much if the government were out of all phases of health care, would costs go down? And most of them said 60%. And the few that didn't were saying 50%. And so here we are at the situation, as things are, costs could go down 50%. But obviously, adding Obamacare is going to cause it to skyrocket even more. So we might get to the point where it could go down 70 or 80%. Who knows?
Well, you're on the right track.
I was just kidding with you, but what my point was going to be, in that whole bill, 1,500 pages or something like that, how many new positions are created in that bill? Anybody knows? No. How many new IRS employees were created? So, I think that pretty much tells what you need to know.